I'm Ray Pardini Matson, and this is the Coffee Monday podcast. Here, we talk about all the things, the messy, the meaningful, and everything in between that fuels your week. I sit down with people who are figuring it out, leveling it up, and keeping it real all along the way. All right, friends, let's pour into it. Today, we're welcoming back a very special returning guest, Dr. Rohini Shantharam. If you've been around Coffee Monday for a while, you'll remember her from one of our very first episodes back in February 2024, where we dove into skincare for teens and tweens, signs of aging, and the basics of cosmetic dermatology. Think Botox 101. Dr. Shantharam is a board-certified dermatologist, fellowship-trained in cosmetic dermatology, and the director of Boswell Dermatology Aesthetics. She's a wife, a mom, a sister, a friend, a daughter, and truly a woman who does it all, and she brings such a refreshing mix of expertise and relatability to this episode. This time, we're going deeper. We'll get into all the trending laser and skincare questions you've probably seen floating around TikTok, what women can expect at her upcoming breakout session at the Central California Women's Conference, and details on her October event, Glow with Confidence. Before we get into all of that, though, let's kick things off with a little icebreaker. You'll hear all of the truths and myths of the world of skincare and beauty. And since you were last here, Rohini, Dr. Shantharam, will share what's one thing that she's added to her skincare routine that has actually stuck. You don't want to miss this episode. Let's get into it.
Dr. Shantharam, Rohini, my good friend, somebody I admire so much. I'm so happy to have you back on the podcast.
I'm super excited to be back. It's been over a year.
Cheers, sister. Yeah, yes. It was February. I looked back. It was February 2024 was the last time you were on. You were one of our first guests. We were filming on an iPhone.
Oh my gosh.
You took your precious time to be with me then, and I'm so grateful that you're back.
It was fun. I still remember it pretty vividly. It was winter time.
It was.
But things evolve.
Things evolve. I feel like so much has changed in just a little over a year and a half.
Yes.
What has been one thing that you've sort of modified or elevated in your self-care routine since this last year?
Good question.
Yeah.
So I'm working out regularly.
Good for you.
Which I had done, played sports when I was young. I think when the practice started and all of my transitions and getting the build out and all of that stuff, I put a little bit of it on the back burner. I would still work out or exercise here and there, but I had excuses of, I have to stay later in clinic or I have to get in early for something. And so slowly it went from like 4 days to like 3 days to 1 day. And I changed that around. So I'm very happy to say I work out 4 days a week now.
That's so great.
Yeah.
And what do you do to stay fit, to help with mental health, all of it, right?
Yeah. And it's so necessary in everything that we do that your mental clarity is intact, and exercising, the endorphins, all of that give that to you, right? Like anytime, sometimes you feel sluggish and you don't want to work out, but anytime you just get up and do it, you always feel better after and more productive. So now I'm doing I'll alternate between Orange Theory. I have a personal trainer, which I needed because I need to have a time that I can have someone else commit to where I can just show up and not think about anything and do all the exercises. But I also love running. So I'll give myself some time. That's my introspection time, my 5 to 8 mile runs.
When your mind is quiet, you have all the ideas.
Yeah.
That's so great.
So fun.
And you've done marathons and stuff, right?
Half marathons.
Yeah.
My husband won't let me do a full marathon because he says that it's really bad on knees, and he replaces knees. So he won't let me.
He knows.
He knows. He's like, there is no way.
Well, I feel like you also too, even with the trainer, Orange Theory, and I'm the same. You need the accountability, you need the time dedicated. You already have so much going on. You allocate it.
Yeah. So as long as it's in the schedule, right? Everything is so scheduled out now that I've committed to this person spending their time training me. I'm going to show up, right? And you do the thing, and you just get to listen to what they tell you to do, and then you feel good after. So
love it.
Yeah,
love it. So you've been you've kind of overseen the growth of your practice. You have even more growth recently too. You expanded your patient rooms, which is absolutely stunning.
Yes.
Gorgeous.
Yeah, I came on board at Boswell Dermatology. We created the aesthetics department and didn't have enough. I have a lot of gadgets and devices, and so the rooms were very small. So we built it out. I have like liposuction equipment. Some of the lasers are a little bit bigger, and so I recently was in one of the smaller rooms again, and I was like, wow, I don't even know how I did it, but for like a span of 8 months, I did do liposuction and use these lasers in this like very cramped room. So we now have the build out. I have a nurse. We just have a new esthetician coming on board. So lots of fun things.
Which is amazing.
Yeah.
Love that. And I feel like last time we talked, it was more just sort of like trending topics, things like teen and tween skincare and sort of how your skin ages and your approach on aging.
Yeah.
Today, I would really love to sort of talk about how you've seen your practice evolve, even in the time that you've been with Boswell and grown that whole division of the company.
Yeah.
And what sort of things we can expect with trends. So I have a few different questions for you here, and you can answer them as short or as long as you'd like. But sort of give our listeners a pulse on where you stand with these things. So what is the most requested laser treatment that you've seen in the last, say, 6 months?
I would say last 6 months, probably treating brown spots. I think it's a pretty common thing. I think with trending social media terms and TikTok, people will come in saying CO2 or resurfacing, not knowing what it means. And so I've seen a little bit of an uptick in things like that. Of course, like celebrities doing CO2 procedures and posting that, they're almost like burn victim face. Patients will come in asking about those. But I would say treating brown spots is probably...
Is that the same thing as like a hyperpigmentation situation where like...
A little bit.
Or not? Okay.
Hyperpigmentation in brown spots, a little different. We treat them differently. Brown spots are lentigo, sunspots. So accumulated over time, sun damage. Hyperpigmentation or pigmentary issues can be secondary to other inflammatory conditions. So we treat them very differently, but it is very important for someone who's treating you to be able to decipher between the two so that you're appropriately treated.
Yeah. Well, okay. So sun damage, essentially.
Sun damage.
That you're probably seeing in people similar to our ages or a little bit older now to be able to sort of see how that's affected their skin, right?
Yeah. So, there's so many other like regenerative treatments, lasers, they're not going to wipe away every single line right away. But when there's pigmentation on the skin, whether it is brown spots or hyperpigmentation, as you mentioned, that no matter what other procedure you do, that if that's visible and that's there and you're trying to apply your makeup and you're still seeing that through, it doesn't feel like you have done much to your skin. I feel like when you can really tackle treating brown spots pretty well, patients are pretty happy about that.
Yeah, amazing.
Yeah.
Okay, so baby Botox. We've talked about this before. You've talked about it on your socials. What are your thoughts? Do you think it's a real thing? Do we think it's a marketing trend? What do you want people to know about that?
Yeah. I didn't really understand baby Botox until it trended. Then I had to look into it. Yeah. Then I was like, okay, I see sort of what they're saying. I think the overall gestalt is that when you treat someone who's a little bit younger, who doesn't have too much movement, you want to be making sure that they look natural, not overdoing it. But in a more scientific concept of it, we think about like dosing and units. And so the way that I think through evaluating someone is, how do I make sure that I treat them adequately? They look natural. And there is that amount of longevity on the product where it hits to that 3 to 6 months, which is where patients want to see their Botox go. So if we tone down the units a little too much and really like baby dose it too much, patient may find that it didn't last as long or it didn't work the way that they wanted it to. So I think overall, it was almost a way of describing doing small amounts allocated in the right areas to make someone look natural for their anatomy.
Makes sense.
Especially when you're in your like early 20s and you're just starting it. You don't want to freeze someone up fully or Spock them where they have that, raised brow and they look unnatural. So that's what baby Botox is to me.
Okay. So speaking of age and like age of treatments.
Yeah.
I know everybody's skin is different. I know genetics are a huge factor, right?
Yeah.
Background, all of that. When-ish would you say is a time to start or potentially start to consider even thinking about like a laser treatment, for example?
Yeah.
Do you see trends as far as age, or is it just all across the board?
So across the board, most people, regardless of their age, will start to lose some collagen, which is that building block protein of the skin, in their late 20s, early 30s. Okay. And so that's a sign that the aging process, which for everyone is happening, the rate at which it's happening is different for everyone. We have genetics that play a role. We have exogenous factors such as amount of sun exposure when you're younger. Are you a smoker, non-smoker, alcohol, non-alcohol? All of those UV exposure, things like that will play a role in the rate of aging. And then the genetics, fair skinned versus more richly complected skin, the effects of UV are a little bit different, right? So all of that is there and that changes things. But in the general sense, I would say most people are looking at starting some of their laser procedures in their like late 20s, early 30s.
Dude, that's earlier than I would have guessed, but it makes sense when you put it that way.
Yeah, I think it's now the concept of regenerative treatments and, early intervention, right? So that term prejuvenation, I think I mentioned it last time. What does it even mean? So it was coined out in Boston by a cosmetic dermatologist, but rejuvenation means treating the signs of aging after they've happened. Pre means starting early intervention to help prevent some of those signs of aging. So I think now, obviously with social media and, being able to see things online, those who have noticed that maybe their parents aged a certain way, they start to see some of that in their 30s. And that's when they'll come in and they say, my mom has some of these changes. I feel like I'm starting to resemble or I'm having some of these changes as well. It's early on, but what can I do to help prevent it?
So I find that so interesting too, because the work that you do is so preventative. And I would imagine that in our lifetime, in the next probably 20 to 40 years, I wonder if that'll affect like facelifts, like a decrease in facelifts. You know what I mean? If you're already working towards preventing.
Yeah.
I don't know. What do you think? Or just more extreme procedures, I guess.
Yes.
Like because you're slowly.
Yes.
Right.
I think definitely it won't fully, just like, now talking about AI and robots taking a field away from, that'll never happen. And there's no extremes here, right? So there will always be someone who, no matter what, will decide to get the facelift. But I fully agree that starting some of these things early, and it's not even like early intervention of doing like an active procedure, but just the understanding of lifestyle changes that people will start to wear sunscreen at a younger age, not sit out in the sun,
not drink as much,
not drink, which is a trend right now.
Whole thing.
Actually, I was in Switzerland and literally the trend is mocktails all over. Like there's so many zero proof like beers and stuff.
Yeah.
It's a thing. And I think a lot of it has to go with how do people feel? How is it aging you? Not just your skin, but your overall health. And I think a lot of this we'll see in the long term.
Okay. So with that though, the rise of things like Ozempic and what do they call them?
GLP-1 agonists.
Okay.
Yeah.
How's that affecting your skin? I mean, loose skin, right? You're losing weight rapidly.
Right.
But are you seeing direct effects from some of that in your work?
That is actually interesting. And I'm trying to understand that direct effect of GLPs on the skin with their like response to a laser treatment sort of a thing. Yes. I haven't fully understood that.
And collagen. I wonder if it affects that. I don't know.
I think time will tell. But I think it's interesting because we're now looking into, obviously, GLP-1 agonists are for weight loss. And now we've learned that it's also involved in anti-inflammatory benefits. So they're looking at those secondary outcomes, how it's affecting people who have autoimmune disease and this and that. And so when we do laser procedures on the skin, we need to create an inflammatory response in the skin. We want to send these cells, T cells, all the different things to create new collagen, elastin. And so for those who are on GLP-1s, I don't know how that's going to change that. We do know that there's still benefits to doing the procedures. And we know what the effect of GLP-1s in general are on the skin. You lose volume, you lose adipose or subcutaneous fat. And so that's why patients will start to see the effects of laxity and things like that. But as far as being on a GLP-1 and getting a procedure done, I am actually looking into that right now.
I bet. It's still so new.
It's so new. I think we'll learn a lot about it. But I think in general, people are healthier. We've seen improvements in other like inflammatory skin conditions. And so there's, dermatologists who work more in the realm of medical dermatology are looking into that right now too. So from a cosmetic standpoint, I don't know. Time will tell. I think in the next few years. So
interesting. So for somebody that wants to get a laser treatment, but is maybe not wanting a ton of downtime and or scared of the pain or the repercussions of that, what treatment or treatments would you recommend for that person?
And I think it really comes down to, my biggest thing with hopefully being this bridge between what's on social media and what treatments do is I always like to set the expectation and really try to understand the patient and what they're expecting and what they want to treat, right? Because you can recommend something, but if that's not really what they came in to get treated, no matter what, they may not be happy, or maybe they didn't understand that this is all it does, or this is what to expect, right? So I think when someone's in their like mid 20s, and they really don't need to do a whole lot, or maybe they had a little bit of acne and they have a little bit of, scarring, you could start with something pretty simple like microneedling, right? Which isn't really a laser. So laser stands for
people.
They think it's a laser, right? So a laser is light energy being transferred in this like very collimated fashion, like one wavelength hitting what we call a chromophore, something within the skin at a very specific depth, at a wavelength. Okay, so that's like the physics behind the laser. And there's devices out there. So one of them being like microneedling is actually just a pen device that has several little needles kind of clustered together, and they go to a certain depth, like about 2.5 millimeters. And that creates controlled injury or trauma into the skin that elicits an inflammatory response. So it's actually not delivering any energy or heat into the skin. Okay. So it fully almost relies on your own body's inflammatory response to kind of do its thing, which when you think about, someone with severe acne scarring, they would need several rounds. It has minimal effects. But someone who's relatively young, healthy, in their late 20s, wants a little bit of a glow up, a little bit of a glow, boost in collagen, a microneedling treatment is fine, right? And it's not very uncomfortable. All of these things we put numbing on, and it's not too bad. But then you approach your 30s, 40s, and now patients are saying, I'm starting to see some fine lines. I'm starting to see some brown. That's when we can consider doing like a resurfacing laser or the IPL. When I said treating brown spots, we typically use an intense pulse light, which is also not a laser. But
which again, I think people would think would be a laser.
Is a laser, yeah.
Right?
Yeah. So intense pulse light is actually just filtered light at different wavelengths. And, most people don't know this, that it could go horribly wrong if it's not done by the right person, because it's actually not a very specific wavelength. So if someone's not paying attention and they want to crank up your energy trying to chase a brown spot, you can end up with little burns on the skin that are rectangular in shape.
Hey, Coffee Monday friends, it's Ray Pardini Matson here with a delicious update from my go-to coffee spot, Dutch Bros. They've just dropped some dreamy seasonal drinks that you, your friends, and even your kids are gonna love. First up, the Mudslide Mocha. Think chocolate milk, Irish cream syrup, and dark chocolate sauce, topped with their new cookies and cream soft top. If you love coffee and dessert in one, this is it. There's also the Strawberry Colada, which is a tropical mix mix of pineapple, coconut, sweet cream, and strawberry fruit that can be ordered as a Rebel, which is an energy drink, lemonade, or blended. And if you're feeling fun, try the Blue Lagoon, a blue raspberry and passion fruit Rebel or lemonade finished with strawberry fruit. Also backed by popular demand and a drink that we've shared with you before is the Mango Nata Rebel and the Mango Nata Lemonade, served with strawberry and a hint of tahini for that bold, sweet, and creamy combo. Plus, fizzes are here to stay. Sparkling fruity sodas like Blue Lagoon, Dino Egg Fizz. The kids love these days. And I mean, I'm a coffee girl, so I've watched my friends rave about these Rebels and the fizzes, and they are just totally obsessed. So those look like fun and a fun, colorful drink to switch it up. So treat yourself to summer in a cup, whether it's a bold energy drink, a creamy mocha, or a refreshing fizz. Check the Dutch Bros app to customize your flavor and at Dutch Bros Fresno on Instagram for all the latest happenings. Coffee, Rebel, lemonade, cheers, friends.
So you bring up a good point there. And that was one of my next questions is, what do you suggest people look for in a provider? Because there are a lot of med spas, every market, not just here, right? There are a lot of like independent providers. There are some obviously doctors like yourself. There are some nurses. Like, how does one that's interested in looking to get treatment done, what would you suggest to them when they're looking for a provider?
Yeah, I think it's so important to read their bio off the bat, get an idea of what their credentials are. In this day and age, there's so many niche like specialties that you can't really do everything and be so good at it, right?
Right.
So yeah, if you do a little bit of this or you practice this kind of medicine and you do this, like, are you really doing, what's your volume of patients that you're actually physically firing the laser on every day, right? So you have to think through that, because this is a device that requires like an understanding of not just how the laser itself works, but how the skin reacts, and everyone's skin reacts differently. And so someone who hasn't really studied skin, I don't know how you could fully understand how to do it or to treat the complication if one were to start to arise, or how to, quickly make sure that like a complication is not going to happen, or you're not going to, continue doing a procedure that someone's not reacting well to. Right. So I think looking into that, there's unfortunately too, they're working on doing a little more legislation around who can perform these treatments.
I heard that, or somebody told me that, even because, that makes sense. I've heard that.
Yeah.
What types of practitioners can use the technology, and where you draw the line, because it's a medical procedure at some point. Yes, you're in cosmetic dermatology, but it's a medical procedure.
It's a medical procedure. Absolutely. So in fact, as a fellow, which is now a few years ago, we're growing a body of evidence because when you're a fellow and you're working, you do see lots of complications that have been performed at other places. And now whoever the provider was, they don't know how to treat it. They don't know what to do next. So then the patient comes into you, and we are now submitting that data to a big database like throughout the country that's being populated by like dermatologists and cosmetic dermatologists to analyze which procedures, what's happening, why, was it preventable, and things like that. Yeah, I know. I've treated things that
I've botched jobs.
Yeah, like scarring from lasers that could have been treated earlier and avoided, and things like that. So
interesting.
Yeah.
So now too, in an age where, like we've talked about, social media can be very overwhelming. There's a lot of access to a lot of information out there. You see people have like 12-step skincare routines, right? Of those 12 steps, or however many they have, what's one item, product that comes to mind where you're like, I think that's unnecessary, overrated. I don't think that's
toners. Get rid of it. Alcohol-based toners.
Like, why? So why? Because like you're already washing your face, you're putting the product on, it's sort of in between,
and if it's like alcohol, it can be, strip your natural oils. It can be drying to the skin. It will, create little micro tears, and then you get irritated faster. So I see no purpose to a toner. I've never used one. I never will.
Good to know. Save your money, folks. Don't put a toner. Okay, what are your thoughts on this whole? Have you heard of like I'm sure, obviously, the morning shed?
Comical. Oh my gosh.
Have you seen?
It's crazy. So first of all, the chin strap.
The chin
Can we talk about that?
Yes,
Because
let's talk about the chin
I
strap.
spend most of my chin lipo consults explaining to the patient that in order for this procedure to go well and for you to have the best outcome, your homework is that you need to wear this chin strap 24/7 for the first week and then at night for the second week.
Yeah.
And that alone will sometimes be a thing that deters a patient. That is considered the downtime because I mean, like you can be swollen down here and put, cover it up pretty well. But if you have to wear a chin strap, that is very obvious, right? You're trying to hide it behind your hair and things like that.
Right.
And so now with
Kim K glamorizes
I was
the
like,
strap.
what is this?
Is that I've seen it. I saw it all over social. Is that supposed to obviously be for bedtime? No?
I
don't know.
But she doesn't. Who's
This makes me laugh. I'm like, this looks like
because it's also uncomfortable. So then the
Yeah.
bedtime situation for my patients who need to wear chin straps for lipo is that they're like, it's not comfortable when I have to go to sleep, but I'll just push through for another week and I'll be done. But
well, and then with the morning shed, I mean, literally, you see women like layering off masks with the chin strap.
Who thinks about who's the first person
I know
who created the morning shed that like made it a trend? That's
a really good question. We should look into that.
Right? Like,
because I already feel like even when I do my red light mask at night, Michael's like, what are you doing? Like, could you imagine?
Right?
The morning shed look is like, it's kind of scary.
And the other thing
and
is
then the mouth tape.
I know.
People do the mouth tape with the mask, with the light.
I know. I saw that.
Strap. It's a whole thing.
I don't know. What if you have like a stuffy nose?
Literally.
How do you get sleep? No.
Yeah.
It's kind of ridiculous. And then if you're putting all these actives and stuff on your skin and then you put this like whatever saran wrappy sticky thing that you have, I don't know what it is. It's going to occlude that product and you can end up with like a chemical burn on your skin if you're putting on like a salicylic acid, treating some acne. So
people don't recommend no morning shed. Well, that was really helpful. I feel like you taught us so many things about the things to squash and the things to consider.
Girl, let me tell you, I'm a minimalist with skincare products.
Tell me what your absolute sunscreen.
Sunscreen.
Okay.
So
moisturizer?
Yeah, 100%.
What else? It's like
vitamin C, sunscreen, moisturizer. If there was no other time for anything else, that would be it. And I'm a girl who became a dermatologist because I had acne. So I have been on Retin-A since like the beginning of time, like 7th grade.
Yeah, okay. So let's talk about that. Because retinol is something everybody's saying helps with aging. And
right.
But can it like over dry your skin too? So obviously go to a provider like yourself that like advises things accordingly. But like then there's that. Then there's people taking Retin-A, retinol, however that works. When they don't necessarily need it or
so
right
yes, so Retin-A is a prescription which came about to treat acne. It helps us shrink up the
I took it too.
Oil glands. It's like actually the first line treatment for acne. Starting at 13, like patients come in. They found that it helps remodel collagen because we found a benefit when we treat acne in helping acne scarring. So scars are from acne that have injured the skin. And now, the word collagen has become in vogue for so long too that everybody wants to build up, But the injured collagen, right, is from acne scars, or if you get a keloid, you have that's a collagen situation too. Thick scars. So, anyways, going back to it, tretinoin. That's how we found out that it helps with not only acne scars but anti-aging benefits because. As you age and you have sun exposure, you break down collagen, and that's how you get fine lines and wrinkles. And so this concept of using Retin-A to help prevent that was there. And then retinol, which is like a derivative of Retin-A, a milder version, is the over-the-counter version you can find, obviously, medical grade skincare at an office, but also you can find it at the drugstore. And nothing wrong with it. And it is great, but all of this can be irritating to the skin.
Right.
So in an overall sense, like someone like me who had acne and more oily skin and who started using Retin-A in 7th grade, I can like slather Retin-A all on my face like 7 days a week and I'm fine.
Yeah.
But someone who hasn't and really didn't have acne, it will be, and they have more eczema prone skin, they'll have a little bit of a harder time tolerating it. So it just means you'll use it a little bit more briefly, maybe a couple times a week for the anti-aging benefits. And you don't want to overdo it.
And isn't that, from what I remember, because I took it in high school too, or used it in high school too. I remember one time I forgot to tell an eyebrow girl that I was taking it.
Yeah.
And I literally like peeled off a layer of skin.
Happens.
So why is that? It makes your skin thinner or something, or?
So actually the opposite, but we have different layers of the skin. Okay. So we have what we call a stratum corneum. We have the epidermis. We have the dermis. Okay. When we talk about thickening up the skin, it's that deep layer called the dermis, which fine lines, aging, all of that is because we lose collagen down in the dermis, right? With Retin-A, it helps to speed up cell turnover and it helps to thin the top layer of your skin called the stratum corneum. So if you do something like traumatic, like waxing or something, it will peel that very top layer. It will never peel off your whole skin and give you an ulcer. But yes, absolutely. When I have my patients start Retin-A for acne and they're maybe waxing the brows, I say, you might want to consider doing threading.
Oh, makes sense.
Yeah. But it doesn't, that's also like a myth I've seen on social about like Retin-A will thin out your skin. The concept.
Again, I think it's like me, like now I know, right? But like lack of knowledge.
Yeah. Yeah.
People believe a lot online that they don't know anything.
But the lack of knowledge is interesting in the sense that the person posting,
I know.
How are they okay?
How are they? They're
okay
with
but
they're not
posting
credible. They're not credible.
Non-credible thing with so much confidence.
Yeah. What a free speech.
Right.
They have their opinions. What are your thoughts on exfoliating? I've heard a lot more, this is funny, buzz around exfoliating lately. This is not a new concept.
No.
It's essentially sort of sloughing off dead old skin, right?
Yeah.
But like, I feel like too much would be bad. Don't over exfoliate, right? Like that can cause like irritation.
Yeah.
So
what about what
are your thoughts? And again, every patient's different. Every person's different. I totally realize that. But in general, is that something that you might recommend to somebody, or is it kind of like not?
Yeah, that's a good question. So in general, our cells are turning over all the time. So if you were to do nothing at all, you're still exfoliating your skin. You're not peeling off like a snake, but every like 21 days, you get new skin that comes in, right? So
21
to, and don't quote me in my textbooks, but like 21, 23. Yeah. So you have the cells are turning over, and that stratum corneum, that very top layer of the skin is just like always turning over on its own, but you're not seeing like your skin peeling off, but you're regenerating new skin, right? And that's, as you age, that slows down a little bit. Okay. When it comes to exfoliation, we sometimes recommend it, but in the form of like chemical exfoliants. We never recommend harsh scrubs, the apricot scrub, none of that. It is harsh and it can be irritating to the skin, right? It's a little bit abrasive. So loofahs, like washcloths, no, you don't want to do any of that. It will create little micro tears in the skin, on your face, or even like on the body in general. You don't need to scrub something so hard. Soap and water is good. But ultimately, with exfoliation, there are certain like chemicals that we recommend in things like salicylic acid or glycolic acid. Even being on Retin-A is we call it the poor man's peel. If you don't have time or money to get a peel and you're on Retin-A, you're naturally getting cell turnover and that's helping with exfoliation. So in the general sense, no, I don't believe in like peeling, like doing anything that's going to cause you to like peel off on the daily. You know, when we're doing these procedures in the clinic and doing a chemical, like a medium depth chemical peel or some sort of laser resurfacing, and we're inducing that in a controlled manner, that's okay because we know what the endpoint is. But on a daily, you are going to just strip all your natural oils. You're going to dry out your skin. Your ability to tolerate some of the actual skincare that we want you to be on is going to be, a lot more reduced. So in that way, I think the gentle approach is the way to go.
Okay. So what about people that are like fearful or intimidated by filler? They don't know where to start. They've never had it. They're scared. It's your face, obviously. Is there like some sort of a gateway to like potentially, if it's recommended, not for everyone?
Yeah.
Are there things that they can like sort of try to see if it might be something they're interested in, or there are alternatives, or what would you recommend for somebody that's a little hesitant just based on feeling maybe overwhelmed or intimidated? Not anti, but.
Right. So, fillers. So I feel like people probably come in being confused about like Botox or neuromodulator versus filler. It's kind of all clumped into that injectables sort of category.
Yeah.
Filler we use for volume loss, which happens again more so in your like 30s. Right?
Okay.
I think for those, and when the trend was to have the bigger lip look, I would say I would have more patients in their mid 20s coming in or early 20s wanting to do lip filler. Okay. And that I think now patients are moving more towards a natural look. So I'm not seeing that as much as I did maybe like 4 or 5 years ago.
Okay.
With the younger population. When it comes to considering starting these things and you're a little bit nervous, I think it's most important to meet with get a consult with whoever your injector, provider, doctor is going to be. Typically, like I have a binder of before and after pictures to kind of show and explain, and just really showing them, with their anatomy, what it's going to do. And I think it takes someone who's done filler, injected it for so long, and really knows, like, I can look at someone within seconds. I know exactly which products I'm going to use, what it's going to do to them, how much I'm going to treat or undertreat initially. All of that is happening within the first like 5 minutes of me talking to someone. But I think that is probably the most important thing is just developing that relationship with whoever is going to do it to feel comfortable. Because I think that element of uncertainty is always going to be there, and that creates the anxiety, right? The uncertainty will always be there when it's your first time because it's never happened, and it's not like we're putting a diagram like on a computer screen and placing the filler in there and showing you this is exactly what you're going to look like. And so I think it's gaining the trust and them really understanding what the outcome is going to be and being able to provide that outcome for the patient.
Yeah, love that. Also, Botox. Let's talk Botox. So where have you done Botox that isn't on the face? I've seen things of like, here. Is that a thing?
Yes. So
that
Trap Talk, Barbie Talks.
Yeah, right? I heard the Barbie reference at one point.
Yes. So
what's the purpose of that? And is it like neck, shoulder area, or what is it?
Yeah. So it's your trapezius muscle. Some women who maybe like work out or just in general keep their stress in their shoulders, which I know I do. I actually do Trap Talks for myself. And this is, I know, like, and then after I've been like working out and doing weights and things like that, I feel like I'm shrugging a little bit. It takes away from like the femininity of having like an elongated neck. And if you're starting to bulge up a little bit in the trap muscle, it can help to relax that. But obviously primary benefit, and that's like a secondary benefit over time, but primary I do have patients who come in specifically because they know they hold all their stress and they like are constantly shrugged. And so it helps to relax and relieve that.
Is it similar to when you get Botox in your face where it takes like 10-ish days to sort of set in, kick in, whatever? Is it similar there or does it take longer?
10 to 14. Okay. And you get the peak at 14. But yeah, obviously it's a very strong muscle. So it does require more Botox to kind of get there. And it obviously isn't going to weaken. We don't want to ever weaken. We won't give you enough to weaken it to where you can't like hold your neck up.
Yeah.
But there's always,
but
things
people like that whole like long neck look.
Yeah.
Like, that's
and
a thing.
Relaxed.
Very feminine, relaxed. Interesting.
Yeah. So that's one area.
Yeah.
The other areas we treat hyperhidrosis, which is sweating, axillary sweating or palmar sweating. And we use Botox there because it kind of closes up the eccrine gland, which is a gland that creates sweat.
So do you put it in like their armpit?
Yep.
Wow. What about your hands? You said palmy, sweaty palms.
Yep.
Where do you put it in your hand?
right in the palmar surface and on the finger surface. Yeah. So I have like, for example, I've had through the years patients who are like cheerleaders or this or that, and they're like, they're sweating and they can't hold on or what, and that's like a quality of life thing that they'll come in. Those are like what we call therapeutic benefits, medical benefits of neuromodulator. And then axillary. So those who are out in public and they get like the armpit holes or the sweating there, we'll do that for them.
Yeah. What about, I've heard people get Botox for migraines.
Yes.
How does that work?
I can't speak to it and I don't want to speak to it in the wrong way. That's more of like a neurology thing. But yes, many people do that, placed in a different location.
Oh, okay. It's placed, it's not on your face.
It's not on your face. I think patients who tend to have like a tension headache sort of a situation because they are straining a lot and frowning a lot, they'll see that benefit after we do glabellar Botox, which is in the frown lines, that it relaxes that. But for migraines and things like that, the neurologist typically will do.
Makes sense.
Yeah.
Okay. Love it. Makes sense. Okay, so we're in a time where seasons are changing. We're going from what feels like summer to all the fall vibes. As we know, people are starting earlier and earlier on prepping for fall and like Halloween. I'm like, I'm sorry, it's August and you want me to put my pumpkins out? No.
Yeah.
But that's just like our like society right now, Like, so when I think fall and I think cosmetic treatments, I do think like, I'm going to hibernate. I'm going to get lasers done. I'm going to do something where I don't have to be in the sun.
Yes.
Is that a real thing? Are you seeing that?
Oh, yes.
Okay.
100%. Especially here in the Central Valley. Because it's just like you get so much ambient sun exposure.
Yeah.
But yeah, our big season for lasers is fall, winter.
Fall, winter. That makes sense.
Yes.
Because you can't be in the sun, right?
Yeah.
Post laser treatment.
Exactly.
Any laser
you want to be cautious because we're delivering energy, light, heat, energy. If you've been out in the sun, you're more prone to having a burn or hyperpigmentation. We can't, crank up your settings or be as aggressive. So we definitely wait until the fall, winter.
Okay.
Yeah.
Well, it's perfect timing. So I'm so excited you're going to be a breakout speaker at this year's Central California Women's Conference.
I'm excited.
I love the conference. I'm a big supporter.
Yes.
I was a speaker last year. I look forward to seeing you speak this year. We're really excited. Your topic, and I'm going to read it just to make sure I get it correct. To laser or not to laser, a modern woman's guide to skin confidence at any age.
Yes.
So I feel like you're going to get a great crowd for this one.
Yeah, I think, again, with like so much on the internet now, I feel like it creates a lot of confusion. I mean, if I didn't do this for a living and studied skin for so long, I would be confused,
right?
About like, what do I do? What do I not do? What is a waste of money? What is worth it? What should my expectation be? And I think that's sort of what I wanted to talk to for anyone, whether they're looking to get a procedure or not, just educating on, how to kind of, the skin is an organ of the body, right? So skin health is something that maybe we didn't talk as much about at one point back like 20, 25 years ago. And it was all about laying out in the sun. And now we've learned so much, about things that how do you incorporate? I mean, everyone's busy. Life in general has gotten busy, right? I guess in America, I was just in Switzerland. It's very different.
Is it?
Yeah.
Are we like hustle, bustle, grind, unhealthy, and they're just like living their best life on a lush land of fresh air?
Oh, yeah. They cut it up. Like, so we went up to, you take these like beautiful gondolas, like up to the top of the Alps, right?
Amazing.
Different locations. So and they have these like alpine playgrounds, which are really cool. Cause your kids can play and it's like the most like amazing, serene environment. So anyways, we took a gondola up and it happened to be like 4:55. We're running a little bit behind, but we get off and the guy was like, well, the last one leaves at 5:30. So if you're not here to get down, you're stuck on the mountain. And there's
like all night?
Yeah. And he goes, you can, cause I'll be gone. Like they won't wait.
They out.
Yeah, they're out. Like they got stuff to do. They're going to live their life and be relaxed.
They have balance. That's nice.
I think so. And part of it's like, put all this stuff into perspective, even skin things, right? People are busy. You don't have all day, people don't have time to do 10-step skincare routines. I mean, truthfully, when we film like a get ready with me video, I'm like trying to put all this stuff on my face. I'm like,
you're like,
I'm usually
this is what I normally put on.
I usually have 3 things.
Literally 3.
3 things. So,
which actually, can I just say, is so refreshing.
yeah,
It is so refreshing. I love how you keep it so simple, so like no nonsense. Like, and yes, I'm sure you could do all the fluffy things, but like there's no actual, well, not no, but like they're not necessary. I think that's very approachable.
Yeah.
And I hope that you share that. I'm sure you will in your session at the women's conference, because I do feel like it can be intimidating for women. Like, gosh, do I need an eye cream? Do I need who knows?
And
like,
truthfully, there's seasons in life, right? Like you go through a 3 months of being busy, whatever it might be, work wise, kid wise, something's going on. You forget you have an eye cream sitting right there because you are just getting ready and like leaving. And truthfully, that happens to me. And then 3 months later, I like revamp. I'm like, oh yeah, I forgot I haven't been using XYZ. So let me just get it back in the schedule. And no harm. That's just life, right? And so I think in general with skin stuff, there's been such a like push of doing all these things.
Totally.
Just put it in perspective and like do little things from the beginning and then just longitudinally see that over time. But like, and then the expectation, right? You go buy 10 different things wherever you may choose to buy it and it costs you X amount of money. Now your expectation is that's going to do all these things.
Yeah.
Will it? It may not, right? Because there's only so much because I do more invasive treatments and things like that. There's only so much a cream will do. So in that way, just think it through and decide when it's the right time to use it, and if you have time to use it.
That's such a good point. There's only so much a cream can do. Like, it's true.
It's true.
Right? And then you gotta level it up or not, or whatever you decide.
Or
right?
and that, for those who are looking for, again, it's all about the goal here is setting an expectation where and because I am the deliverer of what these treatments do, I have to speak to like, if this is what you choose to do and this is what you do, but this is what your if you want to use 3 creams and you choose not to do the Botox or filler, that's fine, but it's not going to erase all those lines, right? It's that black and white. It will prevent. So if you're in your 20s, use it. And yes, you may not age at the rate of your mom who maybe didn't use much, right? So, and we do have, there's been medical grade skincare has come a long way, and they are looking into ways of being able to like deliver hyaluronic acid, which is what's in filler, a little bit more deeply so that it can be used sort of in place of doing injectables. But still at the end of the day, there's only so much a cream.
Yeah. So what are you hoping for at Women's Conference that women take away from your session?
I think that my goal is to just deliver this kind of concept of skin health being something that you can incorporate into your life daily and feel good about it. It's anything that doesn't give you happiness or goodness, it might not be for you. So if like every single time you've had a treatment done and you've walked away hating it and you've decided that like this is not for you, that's okay. Don't do it and do the creams. Or if you've decided that I'm going to do these treatments and I love it and I do feel better about myself after I've done the treatment, then by all means do it, because that's how I want my patients coming back. Does that make sense?
Totally.
Like the goal so that you can
experience say guest experience, the patient experience.
And you feel like, I want to hear I felt better about myself, like doing XYZ. I had this presentation, or I just felt more confident, or my girlfriend said there's something you did but I can't tell, but you look refreshed. That's where it's at. That's the key,
which is a huge piece of confidence building, right?
Huge. Because what's the point of doing all these things, right?
I know. I appreciate that about your approach. I appreciate the education forward part of your approach. Like, I'm sure ladies that come to the session are going to learn a lot.
Yeah, I think it'll be it'll be fun.
It'll be so fun.
Yeah.
And you've spoken at other conferences before. They've been more, from what you've shared with me, more like medical.
Yes.
More like literally doing live treatments of things.
I did. My most recent was anatomy for the injector at the cosmetic surgery conference in San Diego. So we did live injections, and I did a whole presentation on anatomy.
Yeah. So
facial anatomy.
What excites you about speaking to a crowd of all women?
Yeah.
And just, potential, ladies in our community, patients, friends. What excites you about that dynamic of presentation?
I think just being able to, obviously, being in as a physician and going through all the things and the fellowship, it's a very intense sort of trajectory, publication, writing a book chapter. Then you have to be able to prove yourself. And now it's like I'm here and I can kind of just be myself. And then also, chit chat with all the ladies who end up being kind of like my mom or my sister or my friend, and being able to just impart knowledge, and then they can kind of take it and do what they want with it, which is fun.
That. So fun. And I guarantee you're going to have a lot of questions. So save room for the Q&A.
Yay. I'm here for it.
So that's in September 16th.
Yes.
Just around the corner. And then you're going to have a busy fall, aside from it being obviously a busy time of year for you with business and kiddos and all of that. You're hosting an event at Boswell Aesthetics.
Yeah.
October 9th, Glow with Confidence. Tell us about that.
Yes. So I wanted to have a chance to kind of show our new build out of the aesthetics wing, and be able to kind of display some of the devices that we have. We'll have some live demos going on, so that, it can be educational. I think some of these, events can be, there's like so much going on. And at the end of the day, people are like, so what do I get? What do I do?
Yeah.
I'm hoping this to be just a little bit more, we can like intimate in the sense I can talk to people, get an idea of what they're looking for, and then they can kind of see some of these treatments happening. But that was sort of the goal for this one. Yeah.
So great.
Yeah.
Great time of year too. Early October.
Yes.
Before it's probably may or may not still be hot outside.
Oh my gosh. We'll see. Time will tell.
We're manifesting fall for that.
Oh yeah.
Right?
Yeah.
We're
ready.
Great. So how can folks attend RSVP? What does that look like?
Yes. RSVP, we'll put an email. We have an email, aesthetics@boswelldermatology.com.
Okay.
And so RSVPing will kind of secure your spot to enter. But that's really what it is. And we'll have some fun giveaways and raffles and all the good things, skincare and fun stuff.
So fun. Love it. Fun to look forward to. So I have a couple of fun little personal questions to sort of conclude our interview, if you're open to it.
Let's do it.
Okay. So you know how we both have young kids. That's how we originally met. We shared that in the first episode. Your son, my daughter, just fast friends at preschool.
Yeah.
Which is sweet. So you're a mom, and you've probably played this game with your kids before, as far as like if you had any superpower, what would it be? Right? Have you ever been asked that? Okay. So this one is kind of a fun take on your world. So if you had a laser treatment that could zap away anything in life, doesn't have to be skin related, what would it be? What would you zap away?
I think, speaking of kids and all of the social media stuff, it would be to zap away influencers who are not credible.
Yeah.
Because I think I have to deal with it a lot just in patient rooms, trying to explain how, unfortunately, that's not correct or this or that. And then I think that in the grand scheme of things, I am still on this quest of continuing to perfect my craft, which feels to me like I'll never be there, because there is so much learning that has to happen in life. No matter, even when you think you're like an expert at something, you're really not, because there's so much more to learn. And I feel for the next generations, I fear that there's this false sense of, I know what there is to know. I know everything there is to know. And that is so false.
It's terrifying.
It's scary. And so I think in that, like, we get it, our generation, because we're of the generation that like there was barely internet. It was so hard to get on the internet. First of all.
That is perfect segue.
The beautiful floral centerpiece you see on our shows is styled by floral artist Darcy Hovsepian of DH Floral. And the flowers themselves are actually grown and sourced from local flower farms right here in our Central Valley, thanks to the creation of the San Joaquin Flower Collective. As the first and only source for 100% locally grown flowers in the valley, the San Joaquin Flower Collective's biggest mission is to reduce the need for imported flowers for flower growers and lovers alike. By streamlining the ordering process with an online shopping experience, prioritizing collaboration over competition, and raising awareness for our local flower movement through weekly flower pop-ups on Wednesdays from 10 to 12, they're changing the way farm-grown flowers are bought and sold in the valley. As a wholesaler, a retailer, or just a flower lover, you can follow along at SJ Flower Collective on Instagram for their latest happenings and info on their weekly Wednesday Fresh Bloom pop-ups.
We were just talking about before this interview, the dial-up of the AOL Instant Messenger. How that sound is forever in our minds. And we were laughing about what our screen names were. You have to, what was your screen name? You didn't tell me. You have to tell me.
It's so dorky. I don't even know how or why I thought about it.
Please tell me what it was.
Okay. It was Cows Go Moo RS. I don't know. It was so, I don't even know.
Cows Go Moo? Like, was that like a nickname?
I don't know. I don't even know why I thought about that. I actually had forgotten. It's been years.
Your initials, obviously.
But I don't know how I thought about it.
Hilarious.
Maybe I had just taken a trip to India or something. And like in India, cows are like roaming all around on the streets and stuff. And so maybe that's how I thought about it.
That's cute.
What is yours?
Dorky. Oh gosh, mine was Blondie, BLONDI 0087.
Oh, that's good. That's cute.
I don't know why 00. Maybe that was the year. It wasn't the year I created it. We had it before that.
Maybe. Well, because Facebook came out 05.
87 was the year I was born.
Oh yeah.
I mean, real creative. Okay.
That's
my
cute.
gosh, it was so funny. The screen name thing.
Yeah.
Did you ever have a BlackBerry?
I did.
Okay, so did I. Lived and breathed by a BlackBerry.
Yeah.
And then BBM.
BlackBerry Messenger.
Like the BlackBerry Messenger BBM.
Yes.
I used to update my BBMs to words with Ray in it.
Really?
Yes. So like I would insert my name, RAE, into other words. Like crazy, for example. Crazy. CRAEZY.
That's cute. When did BlackBerry? That was like
my post
09 or something.
That was like college / post college.
Yes.
Because I remember I had to work one for a while.
Yeah. That was med school. Okay.
Right?
That's probably why it wasn't too
into it.
Yeah.
Yeah.
But I had a BlackBerry, but I didn't.
Like a small moment though. I feel it wasn't.
I definitely had one
that, popular.
No.
For a long time.
Because then the iPhone came out.
And the iPhone was it.
Yeah. Here we are.
Okay, that was funny. Yeah, that was cute. That wasn't dorky. Your screen name. Okay, but you also made another good point, and this is my last question before we wrap. You're such a good listener. You're a forever student. It seems like you're always learning, always improving, and also listening to your patients.
Yeah.
What would you say is something that you've learned from them this year?
That's a good question. I learn a lot from them. So
I'm sure.
I think I actually do love to talk to like my patients who are in their probably like 60s because they go through so many different like life changes. And I have patients that I've been in town now for 6 years, and all of a sudden I'll have a patient who hadn't come for a couple of years, and then I'll find out they had cancer, and then this and then that, or like random things like that. And so I actually get to know them really well.
I bet.
And then
you build a relationship.
Yeah. And it's like, I'm providing a pretty like in the bigger scheme of life, like a more superficial cosmetic aspect of life. But the conversations that I have with my patients, like when they're in the chair in this like quiet room and I'm injecting them is a lot of their like deep personal life, which like whether, they're going through all, like I learned so many things. And so, I always, and I'll go home that day and I'll like tell my husband like, oh, this happened. Or, I had a patient that I haven't seen and like I didn't even realize that they had like liver cancer. And then now they're this and they're just finished their chemo and I'm so excited for them. And now whatever it is. Or, we did a skin check and I noticed that they had a radiation tattoo and I hadn't seen that last time. And I asked them, they said, yeah, I just finished like, radiation for breast cancer. Like, so many different things that happen on a really deep level. But then we also get to laugh and then I get to provide something that gives them happiness in a different way. And I think that is probably what makes the job fun at the end of the day. There's all the complexity.
Teaches you sort of the vulnerability.
Oh, yeah.
Right? Of them.
Big time. Yeah. I mean, it's like, patients have cried, not from like the pain of the procedure, but like so many other things, cried and laughed and, told me what's going on with their children and all of those things. And I think that being in a field that you do get to have long-term longitudinal patients, continuity, I think for most doctors in general provides a lot of the happiness of what they do, even after they've gone through a crazy busy day and they're like mentally exhausted and, just done a lot of intense treatments where you have to be so focused. I think that part of it is what you leave saying, like, I do really love my job.
How do you go from that world to having like deeply personal conversations with these people and medically treating them and like go, like you do in your days in clinic to like home with your kids and helping them with homework? Like, how do you shift that? Do you have like, what do you do to sort of like, or do you just go on them? It's just all blended, you know?
Sometimes I ask myself that too, because I don't, being a mom, I mean, dads, they do it, but they don't have to, they do it.
They do it and they're very hands-on, but it's all different. It's so different dynamics. And I think as a mom, it's safe to say that we never turn it off.
Never.
So ever. Like, so in the middle of patients, you're probably thinking about, oh gosh, I have to get my son's school supplies, or I need to make sure I sign up for this or follow up with this. Like, it doesn't end just because you're working. That goes for mom and dad.
Yeah.
But I do feel like, I think it's safe to say we think about it a little bit more than maybe the dads do.
Yes.
Because that's just part of the dynamic. That's fine.
Exactly.
They're hands-on, they're amazing, they're involved, all of that. It's just...
But it's different. Like something, right? So for example, yesterday I got home a little bit later. My clinic ended later and me and my husband will toggle things a little bit. And so I come in and it's like all of a sudden an eruption of crying and this and that. And he's like, I don't know. They were fine. Like, you were not here 5 minutes ago and they're fine. Something about mom, it's like all of their difficulties of the day just comes out. Everyone's like crying when you walk home and it's like commotion, right? But that they're like little human beings that need to tell you.
You're their safe space. That's what I tell myself. Same.
Right?
Like, they will be fine all day, even like sometimes with the nanny or husband or whoever. And then the second you walk in, it's like,
this is like everything.
We're at school. Same thing. They treat their teachers differently. They treat their friends differently. They come home from school.
And
so you take it as a compliment, right?
Exactly.
It's their safe space.
Yes.
They feel, safe with us to be able to just sort of
decompress.
Not that they don't with dad, but it's different.
It's different. Yeah. So I think that to answer the question, as I'm driving home, as long as the safety of my patients are all like wrapped up well, which I do these intense procedures. So sometimes I'm thinking about
recovery
at night, patients that, making sure that they're doing okay. And I'll reach out to them and check on them and things like that. But I'm like, okay, I'm done with my day. I got to like turn that off. And then now, there's only a few more hours left in the day until you kind of get them to bed, and you have to try to, the days that I am in very busy clinics and they're like, go with all the procedures. I do in my head, I now know that like, I can't do too many of the extraneous things that I do on my days that I'm not in clinic. Like, the thinking about, because it's all triaging importance. Like, I can't think about like little things of, oh, I forgot to order my son's thing on Amazon, like the little, whatever, he's running out of socks. I don't remember that. I don't.
Right.
But then next day, if I'm toggling my clinic days, I wake up, work out, and then everything else comes flooding back to me. Like, I was supposed to get this. I need to get the supplies. I need to get that. And so I think it's inevitably made me probably a little bit more introverted, not because I am introverted, but when it comes to just like, I have to talk to people all day, every day for so long, right?
That too.
Aren't
you just like zapped?
I'm zapped.
So in the car from work,
laser
home,
zap,
right? Yeah, zap. We could zap away being tired and just have endless amounts of energy.
Yeah,
that would be me. But so in the car from the office to home, are you like sitting in silence? Are you listening to music? Are you listening to a podcast? Are you making phone calls? What are you doing?
I know. I can't listen to podcasts at all. Yeah. Actually, it's really funny. My husband listens to this podcast right now.
Yes.
And he recently, I don't remember what the name of the podcast is, but he was like, he sent me a text when he's like, babe, you got to listen to this like anti-aging thing by Obagi. I was like, I am not listening to that podcast. Like, I already know, like, I could tell you all those things too, but like, I'm not listening to any sort of skincare podcast on my way home. Like, I need some mental time to chill.
Yes. Then it's learning. You're learning on top of all that. Like, you need a moment to breathe.
It's actually for nerds who like to read scientific stuff. So I frequently feel like the hustle and bustle. I love momming and all the things, right? But even that is sometimes hard. Like the days that I'm in my house having to do like house stuff, I find that I get a little bit agitated because my brain is thinking so fast that like then having a chance to read my derm journals or listen to some like intricate thing is actually my calming space. Because I have to like use my brain.
Yeah. Makes sense.
I don't know. It's just my because it's also easy to get anxious with the momming thing. Like, oh my God, I gotta get this kid's project, this thing. I didn't sign up to be like parent, teacher, mom, or whatever it is. And I'm not this and I'm not that. And I'm just like, how do you can't do it all.
You literally can't do it all.
There's just no way.
The village is so real, right?
Yeah.
Like you can't physically be in two places at once. Multiple kids, multiple schools, multiple locations. It's a whole thing.
Multiple mom group chats. Can't make it to all the lunches. Can't make it to the birthday. The this, the that. I can't do it.
I think we're all just doing our best, though, right? You know,
and everyone's different. Everyone does it differently.
Different too. That's true. Everyone's different.
So
yeah. What advice would you give to somebody who's navigating that whole like work and mom life balance? What advice would you give them?
I would just say, and I'm learning it myself. So this is advice that like somebody could just on a day that I need it can tell me the same exact thing that I'm about to say now, right? Like give yourself make sure you take a little bit of time for yourself. Like after this, I did clinic in the morning and I was like trying to not rush, but like, I was like, okay, I have to make it to this, get through it and make sure it's all done and then get here. And then now I'm like, I got to go work out. My kids are home. School hasn't started, but I'm going to get my workout done because it needs to happen and then do the school shopping. But you have to give yourself a little bit of time.
It recharges you.
Yeah. So you can like be a better you and whatever it is that you're doing, your mom, work, all that stuff. And, it's been nice. My mom, she didn't work. She kind of gave up her career for my dad. And then obviously back, when we were growing up, it was harder to get childcare and things like that. And so she has been really solidly a huge source of support for me as a mom who stayed at home. And now having a daughter who's super career oriented to remind me when I can't make it to some kid thing, like I'm leaving for a conference, I can't make it to the meet and greet at school for first grade or whatever. And she's like, it's okay. They'll be okay. As long as you're here for, this and this, you can't make it. So I think hearing someone else remind me.
Validate that.
Yeah. And then there's obviously like Harvard studies and stuff that have shown that if you give your kids even like as much as 5 to 10 minutes of solid, uninterrupted time, even for that short amount of time, and you're like a working mom, whatever it is, at the end of the day, that is what is a bigger picture of their success and happiness, right?
Maybe we share that with each other. I can't remember, but I've read that too.
Yeah.
Uninterrupted one-on-one time.
Yeah.
Even if it's like 5, 10, 15 minutes.
Exactly. And
Yeah.
I think, and then just listening to them and whatever it is that everyone has a different way of doing that. And so I remind myself of that and I do that. And then, and there's again, seasons. There will always be a time where things will kind of ebb and flow. You got to work on your family situation, whatever's going on with your kids, whether it's health things or this and that. And so maybe you'll take a little bit of a backseat on something career wise that you had planned. Like you have, everything is just so calendared out, right? Like I have my calendar set until mid next year already, like my days off, my this, my whatever it is. And so I think having that expectation that it may not go the way that you expect and being okay with it. So that if you have a list of 10 boxes to check off and you only got through 3 to 5, that's actually considered successful.
That's actually a win. I agree 100%.
So,
I feel like parenting also too is the most humbling job there ever is.
Humbling.
So you said it perfectly. It's like even with work and the things that we can control to an extent, we have them calendar out. We have a plan. We're organized, all of that. But when it comes to having a child, even from having the child, I remember with Gwen, we had her naturally, we didn't have a C-section. So I didn't know why she was coming.
Right.
That was the weirdest. Did you have
the first? Yeah, I
plan or
we have a C-section, but post. Yeah.
It was wild.
It's
to not know. I'm like, I'm sorry. I have so much to do. Can we make most of this stuff? And that's like just
you have your like hospital bag set, whatever. You don't even use what's in your hospital.
Oh my God, no. It got smaller and smaller as the kids were born. I'm like, I literally don't even need anything.
No, you just need
a swaddle. They give them a cute little bow or beanie. I need a robe.
Totally.
That's it.
And then
maybe a change of clothes.
Yeah. To go home in. That's it.
Yeah.
So putting it all into perspective, right?
Yeah.
And you just got to roll with it. But I think that's sort of the way that I try to think through things.
So great. So how can listeners and viewers follow you on social media? Tell us your handles.
I have a social media, Instagram, Skin Doc Sean. And then I have a website, which I forgot.
Skin Doc Sean, I think.
Yeah, you're right. www.
Yeah. Love the www. Now you're really dating between AOL.
Right?
A worldwide
gosh. Who puts www anymore?
No, this was fun. Thank you. And yes, we'll make sure to include your website, your socials, all your fun stuff coming up on show notes. And thanks for being here.
Thanks, Ree. This was so fun. Always so fun to chat.
Cheers.
Cheers.
Love it.
Thanks for listening. Feel free to rate and review this episode here and connect with us on Instagram if you have any thoughts, questions, or any guest suggestions. Thanks.